Fortunately, you see a little tendon there too, so that's kind of dangerous because it's getting very close to the bone. So we want to close this sooner than later. Hi, Sharon. We have Sharon here. Hi, Sharon. How are you?
I'm doing okay. Thank you.
Yeah. Sharon's a little nervous because this is a little sensitive. I had to do a little numbing shot, which you didn't feel much, right? You were okay with it.
You were very good and very patient.
Oh, thank you.
The
cold spray and
cold spray,
a little bit of.
I didn't even feel the needle.
Right, good. So we numbed it up a little. Now this started as a little spider bite, something like that, right? That happened like about a couple months ago.
It was over about September.
Oh, September. Oh, so it's been a while. So you've been taking antibiotics, right, for this?
I've been on 3 different types of
antibiotics. Different types. Okay. So it's a little tender. So I numbed this area. So I'm going to clean up a little bit, let it bleed a little. I'm getting circulation tests done to make sure that there'll be a good circulation before I be a little bit more aggressive and clean all this, because we need to clean the edges out to be able to have this wound to kind of close. And unfortunately, you see a little tendon there too, so that's kind of dangerous because it's getting very close to the bone. So we want to close this sooner than later. So
I'm very glad that you were able to see me.
Yes. So we're going to clean it up a little. Now, if you feel anything, just let me know, okay? Do you feel that?
Not yet.
You should be numb. You should be numb there.
I'm just waiting for it to feel okay.
You feel something?
Just pressure though.
Okay.
Nothing sharp, right?
Nothing sharp.
Yeah, just pressure, yeah. Because that area is numb now. I already numbed it, so I'm just cleaning out all these scabs.
I just have so much fear, so I just appreciate it.
I know, no problem. Is it sharp or just pressure?
Sharp. I felt sharp.
Oh, you felt sharp. Okay. So we're just going to clean up a little bit more here. I'm not going to go there anymore. I'm just going to stay on this side. Right?
Okay. Tiny sharp.
Huh?
Tiny sharp.
Tiny sharp?
Yes.
Okay, good. How about now?
No. Trying to be a good patient.
I know. So far you go. You haven't kicked me yet.
I promise you I won't. I appreciate your help.
Yeah, we'll do as much as we can today, and then have you soak it, and I'll show you to do what we call the wet to dry dressing, which will clean out all these things. Also going to give you some medicine that kind of debrides this whole thing on its own. Okay, so I don't have to do this all the time. And then the soaking, and then okay, take your time. No problem. I'll do what I can, and then I'll give you a medication which will kind of clean it out yourself, kind of clean the area out on its own. Yeah, it kind of cleans out all these dead tissues.
Okay.
Nicely. So I'll give you a prescription for that. And then
give my daughter all the instructions because I'm legally blind, so I can't do it at all.
Yeah, no problem. How's that? You feel that?
Just pressure.
Yeah, it's just mostly pressure, okay? Because the area already numbed it. But I don't want to do too much because we just met. I don't want to cause any trouble.
Okay.
We want to be in good...
Oh, I'll be a patient for life.
Yes, hopefully you get better and you have to see me for a while.
Amen. Amen.
That's right, amen to that, right?
Amen.
Okay. Just keep praying.
Pray with the right specialist? Yeah.
Just keep praying for me as well. Okay?
I am praying for your hands, praying for your patients, praying for your clients. I have been.
Yeah. You're doing great. You're doing great. I'm cleaning more.
Thank you. It's a little sharp.
Doing great though.
Okay. Yeah, okay.
Did you feel something?
Yes. So sharp.
That's sharp?
Uh-huh.
Is that too much?
Yeah.
Okay, I have an idea. I think if I pull on it, it'll like it. So I'm gonna just kind of scrape it a little bit, and then that's all. Okay. And then when I give you the medicine, I think that's what's gonna do a lot of cleaning on its own and let it debride. Next time, I think you would allow me to numb it up more, because I think you were too scared for me to numb it for you.
I thank you for allowing me to work with it to pace. Okay.
It was sensitive?
Yes.
Okay.
How's it feeling?
Have you had anything like this happen in the past? Where you had like some kind of a bite and then started getting big like this?
I've had chronic eczema. I've had
Oh, you had an eczema?
yes, a tropic. I had such a large bite on my breast, they wanted to remove my breast.
Really? So what caused that?
From the atopic stress.
Atrophic? What does that mean? You mean atopic?
Yes.
Is that like a dermatitis? Atopic dermatitis?
Yes, eczema.
It's an eczema. So it's some kind of a
I did a lot of outreach down in Skleer area,
oh.
so my immune system actually I overloaded it.
Oh, really?
So I was
So were you helping the
yes,
homeless and everything?
yes,
Oh, bless your heart.
I am.
So were you feeding them, or what were you doing for them?
I was trying to negotiate with the Department of Mental Health and a few health agencies to acquire a building to have on-site services.
Oh,
24
really?
hours,
Oh, wow.
under the guise it was Skid Row,
That's downtown, right?
downtown on 4th Street, the state-of-the-art center.
Yeah, I've been there before.
Yes, it needs so much help now.
Especially now, huh? With all this going
I
on.
haven't been here because I have been too ill to make it there.
Really? Well, with Lord's help, we'll be able to get you back there. How's that?
I appreciate I can advocate for a lot of people.
Yeah, let's try to get you back this year, huh? What do you think?
Yeah, I'm going to be doing a lot of stuff. If you could get me on my feet, I'll be doing a lot of mobile.
Right, but if somebody has like your condition, this comes from your stomach. And as a naturopathic doctor as well, I can really help you.
I need that. I need to detox my whole body.
Exactly. Improve your gut lining. When you do that, that's when you'll be able to heal this. So I'm going to put you on a program that improves your gut health, including collagen supplement. You're doing really well. By the way, I'm really cleaning a lot.
Yes, thank you.
Yeah, I'm really cleaning a lot.
Great, Mom.
But unfortunately, I cannot heal for you. You have to heal yourself.
With your help and being a naturopathic, I could do a lot.
Exactly. So
you could
I have a
guide me.
yeah, I have a protocol that I have for my patient with the autoimmune disease or allergies or gut issues, which is what you have. Then you'll be able to heal the skin on your own. Also gonna offer you hyperbaric oxygen treatment, which we have. And since you offered to be on our YouTube channel, I'm going to offer you to be on the tank at no charge to you.
Wonderful.
And that'll improve this very quickly, okay?
Wonderful.
Yeah, so I first recommend you take probiotics supplement, which I'm going to write all this down for you. And then you need to take collagen supplement or eat bone broth soup. You let me do a lot, by the way. Okay? Like a bone broth soup that heals your gut, okay?
Do you have a bone broth? I don't know.
Yeah, I'll tell you how to do it. You YouTube it, and then you find out exactly how to...
Hold on, do you need a break, Mom?
Do you need a break? Okay, good. We'll take a break. We'll just talk. And then what we do is like a collagen supplement or bone broth. Okay, and then we do a little bit of the detox. Okay, you can do juice detoxing. Do you juice at all?
I'm gonna be doing a lot more now.
Okay, you're gonna be juicing. You're gonna take some products that I recommend, the probiotics and the fermented vegetable. You have to ferment vegetables. That regrows all your gut lining and it decreases inflammation, and that's going to in turn heal your wound.
We're gonna you'll give a description, so.
Yeah, I'll give you all the descriptions of exactly what those protocols are, and then I'll put you on an oxygen tank, and then we'll monitor how this is healing. And obviously, our goal is to get you back out there within this year. Okay.
Sounds wonderful.
Yeah. So I took out another layer there. I'm going to give you medicine to put on so you'll clean out on its own, and then have you start the program and put you on the oxygen tank as well.
Does the oxygen tank just cover my body or the whole body, or?
You have to go inside a tank.
Okay.
Are you claustrophobic?
I'm fine.
Yeah. Okay. If you're not claustrophobic, then you can go there and do that, and that'll really help accelerate. You'll be amazed how quickly this can heal.
Okay.
Okay, but it's an inside job. You have to heal it. I want to heal for you, but I cannot heal for you, right?
If you give me the best of your abilities, and I follow the guidelines, I'm ready for that.
Okay.
I don't want to go. I don't want to. We will not be going through this process again.
Yes. So. Okay. Okay, Sharon. Thanks for allowing me to film you today. I'm very excited to show you how quickly we can heal this internally and externally, okay?
I appreciate that.
Okay, very good.